Alright, so we're quickly looking at the pathology of alcoholic liver disease. Pathology of alcoholic liver disease, right? So for this alcoholic liver disease, it's just like the name implies, right? Too much alcohol, your liver is actually saddled with the task of detoxifying all those drugs, toxic stuff in your body. So alcohol is one of those toxic stuff. So of course your body is trying to detoxify them. You understand? So as your body, as your liver is trying to detoxify them, it's basically becoming too much for the liver. You understand? So the liver is now getting spoiled. So we'll talk about the introduction, the spectrum of the disease associated, the forms of alcoholic liver disease, the pathogenesis, the prognostic factors, the morphology, and all of that. Okay. So for introduction, we said that alcohol is actually a psychoactive substance. All right. So when you're taking it, there's a possibility. It's not even sweet. I don't even take alcohol in my life. I like sweet things. I like meat. You understand? So because you are taking this alcohol, it's a psychoactive stuff. So it can make you now be dependent on it. You understand? So what is the spectrum of disease caused by excessive alcohol intake? It could cause what? Steatosis, alcoholic hepatitis, fibrosis of the liver, alcoholic cirrhosis. All right, you understand? All right, hepatocellular carcinoma. Okay, so this type of this diseases they will occur in about 90 to 95% of heavy drinkers. Then up to 35% develop advanced alcohol liver disease. Okay, so forms of alcoholic liver disease could be steatosis or fatty changes, alcoholic steatohepatitis. So there's inflammation of the liver because probably there's now fat and all of that. Fibrosis, that's cirrhosis, right? So pathogenesis is that 6 bottles of beer over 1 to several days produce steatosis. So more than 80 milligrams per day may potentially cause severe injury, but only 10 to 15% of alcoholics actually develop cirrhosis. Alright, so this one is just trying to show the different levels. You see the healthy liver, you see hepatic steatosis, you see how fibrosis begins, you have cirrhosis begins. Then the last one is actually when it now becomes cancerous. That's a hepatocellular carcinoma. You understand? So excessive alcohol intake causes steatosis. It now causes dysfunction of the mitochondria. Now, because the cells are not actually functioning well, now you have oxidative stress. Then there's injuries to the liver. Okay. So alcohol dehydrogenase and acetaldehyde dehydrogenase generates large amounts of reduced nicotinamide adenine dinucleotide, which alters the redox balance. That's now talking about how the oxidative stress comes in. Right? So it also causes increased lipogenesis, deposition of fat, improper lipoprotein assembly and secretion. There's increased peripheral catabolism of fat. Aldehyde also induces what lipid peroxidation. Then the cytochrome 2E1 increases what? All those oxygen species, right? That's redox oxygen species and all of that. So now there's also decreased methionine or metabolism. This will now lead to what? Decreased glutathione availability. Thereby to now increase the risks of what? Oxidative stress and injuries to the liver. You get? So the whole thing just trying to look at. So prognostic factor. There's a poor prognosis. Okay, sorry. For people that have poor prognosis, if it occurs in the female gender, it's much more lethal. Obesity, race is more common in blacks. Daily or nearly drinking heavily every day. Drinking at an early age. Then probably you have this alcoholic liver disease and you have some other liver problems too. You get? Then yeah, genetic susceptibility. Probably like let me say in your genes you guys are just naturally susceptible to it. Okay. So morphology, how will a liver that has this alcoholic liver disease be looking like? So initial weight of liver is about 4,000 grams to 6,000 grams. That's about 4 to 6 kilograms. All right. Mm, okay, that's like beginning. You understand? It's yellow, it's greasy, it's easily broken. Later, the liver becomes red with bile stained areas, okay? May contain visible nodules, fibrosis, and all of that. Histology. If you observe, you see steatosis, right? Everything here actually describes it. You see steatosis, then what? Most common and earliest form of the liver disease, that's the steatosis. Then predominantly there's macrovascular steatosis. Classically, there's a single large fat drop displacing the nucleus, and there may be small or moderate droplets. So it first appears in the perivenular region, then it spread to other region if you are still drinking, right? Then sometimes if you stop drinking, it might actually will cease. You understand? So next morphological feature is alcoholic hepatitis. This one, the statosis and is coupled up with what? Inflammation. Hepatitis, anything itis is inflammation, right? So there's inflammation of liver cells simply because you are still continuing with the alcohol. It's ballooning degeneration, there's litosis, right? Mallory dengue bodies, chicken wire fibrosis, perivenular and what? Pericellular fibrosis, okay? Then the alcoholic cirrhosis now is classically macronodular cirrhosis. So steatosis and there's ballooned hepatocytes, okay, may turn out into advanced fibrosis or cirrhosis, okay. So what are the possible causes of death? So okay, there could be hepatic coma, there could be massive gastrointestinal hemorrhage, infections could come in because probably your immune system is getting weak, hepatorenal syndrome, right? Hepatocellular carcinoma. These are the things that will actually cause death in this type of thing. All right. So that was it, guys.